Hello guys, so now we shall be discussing regarding the topic of prostate gland. Our topic of discussion would be regarding the prostate gland. Okay. Now, regarding this prostate gland, what are the important things you need to know? First important thing you need to know is that prostate gland is a fibromuscular gland. So, prostate gland is a fibromuscular gland. Okay, so this is what is about your prostate gland. Second important thing is that where is the position of this gland, right? So where do you find this gland? Where is the position of this gland? The position of this gland is below the neck, right? The neck of the urinary bladder, and it is 2 centimeters behind. It is 2 centimeters behind the lower border of the pubic symphysis. Okay, where it is present below the neck. Okay, so it is present below the neck of your urinary bladder, and it is also present 2 centimeters behind the lower border of pubic symphysis. The lower border of pubic symphysis. Okay, it is present behind the neck 2 centimeters, below the neck 2 centimeters behind the lower border of your pubic symphysis. Now, what is the shape of this structure over here? The shape is in the form of an inverted cone. Okay, the shape is in the form of an inverted cone. So, inverted cone shaped structure, right? So, if you look at the urinary bladder like this, so let us say this is your urinary bladder in this way, right? So, here is your prostate gland. So, this single gland over here is your prostate gland like this. Okay. Now, we will discuss about the clinical part of the prostate gland later on, but for now what we shall do is that if you look at the prostate gland, which is present like this, like an inverted cone, right? So, if you make a transverse section of this prostate gland, and if you are looking from the top, and what are the different kinds of anatomical lobes do you have? Okay, so if we are discussing about the lobes of the prostate gland, we will discuss about the lobes of the prostate gland. Now, coming on to the lobes of the prostate gland, what are the different lobes which you would appreciate over here? The first important thing is that, for example, this is the cut section of your prostate gland, let us say. This is a cut section of your prostate gland. Now, in this particular cut section of your prostate gland, on the top, here on the top, you have got this particular structure. You see, this particular structure is called as an anterior lobe. Okay, you see this particular structure over here. This particular structure over here is called as your anterior lobe. Now, after anterior lobe, down here, you have got another important structure like this. This particular structure over here is called as your posterior lobe. One is your anterior lobe, another one is your posterior lobe. Next, you see another structure like this. This particular structure over here is called as your urethra. What is this? This is called as your urethra. Now, after the urethra, this part which you can see over here, right, after the urethra, this particular part which you can see over here is called as the median lobe. Okay, so what are the different lobes over here? So, one lobe which you have on the top is called as the anterior lobe of the prostate. Down here you got is a posterior lobe, next you got is a medial lobe. Now, after this, there is another lobe that is present over here. You see this particular lobe like this, right? So, this particular lobe which you can see over here is called as your lateral lobe. Okay, so what is this particular lobe over here? This particular lobe over here is called as your lateral lobe. This particular lobe over here is called as your lateral lobe. So, let me name all these lobes over here. So, this particular lobe over here is called as your anterior lobe. Okay, this is called as your posterior lobe. This one over here is called as your median lobe, and this is called as your lateral lobe. So there are four important lobes. Apart from that, this center part, whatever is there here, right, which I'm highlighting right now, this center portion, whatever you can see over here, this part over here is called as what? This is called as your urethra. This is called as your urethra. So actually the center part you have got is a urethra, completely surrounding this you have got is a prostate gland. Okay, so this is one of the very important thing. Next important thing is that there is another classification of what are the different zones of the prostate gland. Within the prostate gland, when you cut it down, so prostate gland is divided into different zones. Okay, so what are the different zones of the prostate gland? So the first important zone they mentioned is that is called as a central zone. So central zone, what is central zone? Central zone is the zone that has to be present in the center, you see. So this particular zone over here is called as your central zone. Okay, and this yellow color duct which you can see in the center is called as your urethra. Next, after the central zone, the second important zone which you can see over here is called as transitional zone. The next important zone you got is the transitional zone. Now what is the transitional zone, where it is located? Transitional zone is located exactly in the center and it is surrounding the urethra. You see, in the center of this transitional or this green color zone, a pipe is passing, an yellow color pipe which is called as urethra. Okay, it is located exactly in the center. This zone is located in the center and it is completely surrounding your urethra. So this zone is located centrally and it is what? It is surrounding the urethra. It is surrounding the urethra. Okay. Next, after this, the third important zone which you can see over here is called as a peripheral zone. This blue color zone you see, this blue color zone is called as your peripheral zone. Peripheral zone. And the final last important thing is you see this fibromuscular stroma. This fibromuscular stroma is also called as a fourth zone. Okay, the fourth zone. What is the fourth zone? The fourth zone is nothing but called as your fibromuscular stroma. Fibromuscular stroma. Fibromuscular stroma is your fourth important zone, right? Now, next important thing is that you need to know one very important thing over here, that for example, this is your urinary bladder. This is your urinary bladder and this is your urethra like this. Where is your prostate gland located? On either side like this. So this is your prostate gland. Now what can happen here is that mostly in the individuals, right, most of the patients after 40 to 50 years, let us say after 50 years, what they will have? They will have a difficulty urination, right? Difficulty urination. You even observe most of the old patients after 40-50 years and all, they have difficulty micturition, I mean urination. Why there is difficulty urination is that this prostate gland is enlarged in them. Okay, so when the prostate gland is enlarged, you see, when the prostate gland is enlarged, what is happening? What is happening is that they are compressing the structure that is present in the center. In the center, what do you have? You have got the urethra. So as this prostate gland is enlarging, they compress the structure which is present in the center. So what will happen is that the urethra will become completely narrow. So when the urethra is becoming completely narrow, what will happen? This would lead to stasis of urine within the urinary bladder itself. Okay, so this condition where the prostate gland has been enlarged, this condition where the prostate gland has been enlarged, right? So this condition you call it as benign prostate hyperplasia, benign prostatic hyperplasia. In an abbreviated form, you just call it as BPH, benign prostatic hyperplasia. Okay, so let me show it to you one very important thing over here regarding the benign prostatic hyperplasia. So right guys. So as you can see over here, right, as you can see over here, that in this particular animation, right, what is the important thing you can see? This is from the anterior view, right? So this is from the anterior view. So when I'm zooming it inside, when I'm looking it from the side, all of you know that this is your urinary bladder. Okay, so what is this? This is your urinary bladder. And where are your ureters? You see the ureters are here. You see, this is the left ureter entering into the urinary bladder, and this is the right ureter that is entering into the urinary bladder. Okay, now what we will do is that we will remove the urinary bladder here. You see, I have removed the urinary bladder. Now after when I remove the urinary bladder, you can very clearly look at the prostate here. Even if I don't remove the urinary bladder also, down here you have got prostate. But I want you to know in the center of the prostate what do you have. So I am removing the urinary bladder. See, in the center of the prostate, you see this duct over here. What is this? Urethra. So now tell me, if the prostate gland is enlarged, don't you think it will compress the urethra in the center? If it will compress the urethra in the center, do you think urine will be passed normally? Urine will not be passed normally, right? So when urine is not passed normally, what is going to happen? What is going to happen? What is going to happen is that, see, I will draw this thing over here and explain you. For example, let us say that this is the kidney of the patient, okay, and this is the ureter like this. Okay, this is your ureter, and all of you know that this is your urinary bladder. This is another ureter like this, and this is the urethra of the patient. Now where is your gland located? Your gland is completely surrounding like this. You know this thing, right? So let us say this gland is completely compressing the central urethra. Once it has completely compressed the central urethra, what is happening? What is happening is that the urine will stay within the urinary bladder, right? The urine will not pass down. So later on what will happen is that slowly this urine will go back retrogradely into the ureters. From the ureters it will enter into your kidneys. Okay, so this condition you call it as vesico-ureteric reflex. Okay, what is this condition called as? Vesico-ureteric reflex. From the vesica in the sense from the urinary bladder, ureteric in the sense to the ureter. This condition is called vesico-ureteric reflux. So because of this vesico-ureteric reflux, what is happening? There is a lot of urine that is getting deposited within the kidney. So when the urine is getting deposited within the kidney, so don't you think after some time, right, gradually the size of the kidney is enlarged? So this irregular enlargement of the size of your kidney is called as hydronephrosis. Hydronephrosis. So patient is going to have what? Patient is going to have hydronephrosis in this case. Hydronephrosis because of what? Because of vesico-ureteric reflux. Okay. So in this case, how do you examine this patient? How do you examine the prostate gland is that you put your finger back into the rectum and palpate the prostate gland. Now why are you putting? Prostate gland is located surrounding the urethra. Urethra is present in the front. But why are you putting your finger back into the rectum? The reason is that, look at this animation once again, right? So this is your prostate gland, right? This is your prostate gland. Now what I will do is that I will add the digestive system over here so that you will understand it completely, right? So now just look at this particular structure over here. See, this is your prostate gland, right? This is your prostate gland, and behind your prostate gland what do you have? What is this? This is your rectum. If you wanted to palpate your prostate gland, you will put your finger into the rectum. Okay, so let me draw this thing so that you will understand. What I am doing is that you are putting your finger into the rectum and palpating. This is your finger. Let us say you are putting finger into the rectum and palpating your prostate gland. Right? If the prostate gland is enlarged, you can very easily palpate. Now, after palpating, what is the next important thing you do? What is the next important thing you do is that if this is a prostate gland, you are putting finger into the rectum and now you are palpating the prostate gland like this. Now, I will see is the prostate gland on the right side and prostate gland on the left side. Both of the halves are symmetrical. It means both of them are smooth, symmetrical, they are equally enlarged or not. right? So if I find that yes, both the halves of the prostate gland are symmetrically enlarged, the texture on the right side, the texture on the left side of the prostate gland, both of them are similar, the same texture, evenly they have enlarged and all, then I will write the diagnosis as benign prostatic hyperplasia. Okay, so I will also give drugs according to that. For example, I will give finasteride and all. Okay, so tamsulosin, finasteride and all. So these drugs you will study later on in your medicine part. So what I will do is, when after putting my finger inside and when I'm palpating it, I find there are some irregularities, right? So irregularities in the sense, for example, if this is your prostate gland like this is your prostate gland which is enlarged, and this is also your prostate gland which is enlarged. Now when you're palpating, right, this is your prostate gland which is enlarged like this. Now if you are palpating both the glands, let us say if you are palpating the gland number 1, right, let us say this is patient number 1, you are palpating it, you will find the surface very smooth. But when you are palpating patient number 2, you will find the surface rough. So if you find any rough surface, or if you find that the right side of the prostate size is lesser or greater than the left side, if there is asymmetric in sizes, right, if you feel that, then it means this condition can be called as prostatic cancer. Okay, so there are two important conditions you should know. One is called as BPH, another one is called as prostatic cancer. Prostatic cancer. Okay, so according to that you do. But if you find that the patient is having whatever I have palpated is irregular, right, asymmetric and all, then directly you cannot tell it as prostatic cancer. First you need to do a test called PSA. What is PSA? PSA is prostate specific antigen. If the prostate specific antigen level is more than 1.5, then you can confirm and diagnose it as prostate cancer. So all these things, if you want to remember it in anatomy, that is well and good, but you will anyway study it in urology, right? In urology, nephrology and in medicine part mainly, you will study all these cases. Even in surgery also, you will study these cases, okay? So this is the important thing which you need to know. Now, when it comes to the arteries, what is the important thing you do over here? When it comes to the arteries, the artery which is over here is internal iliac artery. Okay, so internal iliac artery will give out a branch called as prostatic arteries. You give it a branch called as prostatic arteries, and these prostatic arteries, they supply this prostate gland. Okay, next, when it comes to the innervation, what nerves are innervating the prostate gland? What are the important nerves which you need to know? You know, sympathetic plexus, right? The parasympathetic nerves, the sympathetic, parasympathetic and the sensory innervation. So all these three things are coming from which plexus? They are coming from the inferior hypogastric plexus. Okay, so your sympathetic input, your parasympathetic input, as well as your sensory innervation, all of them are coming from where? They are coming from inferior hypogastric plexus. They are coming from where? They are coming from inferior hypogastric plexus. Okay, so this is one of the important thing which you need to know. So this is all you need to know regarding the prostate gland, guys. So thank you so much for watching my video. Goodbye.